Welcome to Vector Flow and Convergent webinar, Integration and Innovation, Enhancing Patient Visitor Management. So before we move on to the presentation, I'd like to cover a couple of housekeeping items. You're welcome to ask your questions throughout the entire session. You can send them through the chat tab at the bottom of your player, and we'll take a couple of minutes at the end of the session to answer your questions. As a reminder, this session is being recorded, so please be sure to check your emails in the next 48 hours to access the recording. If you want to share it with your colleagues, please feel free to forward them the invite or just use the link to watch the recording at your convenience. We also have some handouts we'd like to send your way, which will be included in our follow-up email. So with that, I'd like to go ahead and introduce our speakers for today. Please meet Phil Leclerc, who is the Director of Security at HCA Healthcare Memorial Suchila, with a demonstrated history of working in the hospital and healthcare industry. He has a significant experience in crisis management, law enforcement, emergency management, planning, and patrol. In his role, he is responsible for managing and coordinating the security services, campus, community, and system operations divisions, ensuring all requirements and directives are successfully completed. He also advises regarding policies and procedures that are essential to maintaining appropriate staffing levels and operational resources to ensure safe and secure environment. On the Vector Flow side, we have Jeanette Evans. Jeanette is the healthcare practice lead at Vector Flow. In this role, he partners with healthcare organizations across North America to help solve their physical identity and access management challenges. Jeanette is passionate about helping healthcare organizations harness the power of their data to enhance security and compliance, mitigate risks, and decrease costs. Based in Dallas, Jeanette has been a member of the security industry for over 14 years. And on the Convergent side, we have Doug Greenwald, the Digital Transformation Advisor. He has spent 12 years in the physical security industry, with an additional 4 years spent delivering solutions in the cybersecurity and infrastructure monitoring space for cloud computing deployments. Doug is responsible for helping global companies navigate the technology evolution taking place in the security industry to identify and implement complex solutions ranging from PIM, PSIM, workspace efficiency, IoT security, and optimization. So our focus for today is to provide all healthcare professionals joining us today with some of the solutions you can implement today to improve the patient visitor experience and increase security, so that hopefully by the end of the session, you will have a couple of solutions you can discuss with your senior leadership to implement them to mitigate and prevent tragic incidents or near misses in your organization. And without any further ado, I'm excited to start the conversation with our speakers. So Phil, I can probably speak on behalf of everyone here joining us online. We all have been to a hospital at some point of our lives or have our friends or loved ones working in this industry. So looking at the most recent events in the US, we're all alerted and concerned about security. And we all know that it's not a novel situation. So Phil, it's 2022. What are the challenges hospitals are facing as far as visitor patient management that impact security, and why do we continue talking about it?
Thank you, Ned, and thank you for that. First of all, I want to thank everyone for being on the webinar here, and thank you for the opportunity. You know, all our colleagues that are on this webinar today have probably experienced something in their facilities, or know about our colleagues that have experienced some things in our facilities as well. Our issues and concerns with visitors and patients, historically, it's a matter of not knowing who's in your building. We talk about workplace violence. We talk about active shooter a lot, and those are instances that could occur, but it would make it a little bit more effective if we come to who is in our facility. Now, it doesn't mean just because we know who's in our facility that we're not going to have workplace violence and we're not going to have active shooter events. But in 2022, we have seen a number of different events since January 1st that have concerned us in the healthcare, where we've had either active shooter events or near misses that you had mentioned in your introductory. The near misses are what causes us more heartache because we don't recognize the fact that there's an incident occurring. But what has happened is awareness from the employee that has stopped or mitigated a potential risk of an active shooter or a workplace violence incident. Now, all of our colleagues across the country, if you have a visitor management system that's great, but we don't use it to the extent of what it's used for. There's one thing to use for a pass system, but then there's other hospitals and healthcare systems that don't use it. And it's time for us to move forward to try to figure out who's in our organization. And it should start in our primary areas that cause us the most heartache, your behavioral health area, your EDs, and your mother baby units, if you will. So I think I call that the trifecta in any healthcare. When you're dealing with those three entities, those cause us all most of the heartache. And so we know that we've had instances just recently on the mother baby unit in Dallas, where if we don't know, I don't know if that organization had a visitor management system, but even though if they had it, they know who was there, but it wouldn't prevent that incident from happening. So you've got to ask some questions as well. So that's kind of like an overall response to your initial question, but I think that's where we need to start.
Yeah, Phil, appreciate that kind of introduction and thank you for being on today. So when we think about how things have kind of changed over the last couple of years, especially coming out of the pandemic, right? You're kind of on the front lines, you're seeing how the hospital has to respond and evolve. Beyond workplace violence, what are some of the other challenges you're experiencing when bringing visitors into hospitals or clinics to visit patients?
Great question, Doug. It's not always a workplace violence incident that occurs that we want to know about folks. I will tell you that the pandemic, I think most of my colleagues out there will agree that in some ways the pandemic from a security perspective was good to us because it's been something that we've been asking for in many cases. And I know that um, the organizations in which I was associated with during the pandemic, we were on lockdown, so to speak, where we only had two entrances to our hospital, and so and we have multiple, up to 50 entrance ways to get into that organization. But because of the pandemic, we wanted to control the flow of folks, to know who's in or who's not in, and it had nothing to do with workplace. It was to create a safe environment for patients and really no visitors during the pandemic, um, that we wouldn't increase the pandemic, the COVID-19 virus to anyone. And so we went on to real restriction of visitation. Again, nothing to do with workplace violence, but clearly to create a safe, a healthy environment while our patients are being treated and keeping staff safe of any infection. And so the screening process that we went through, limiting access into our facility, was crucial. And now that it's post pandemic, we're now seeing that our organizations are kind of lifting those restrictions. We're kind of saying, well, let's see where we can open up, you know, uh, the main, whether it's the main entrance or whether it's maybe the ER entryway where we can allow folks. It doesn't matter whatever the label is, but we're starting to look at how can we now allow other folks to move more freer through our organizations. Now the challenges become how do we secure it and who's in our building at this point in time.
Yeah, absolutely. I mean, those are all things that similar healthcare organizations have been challenged with, right? It was from, very open, go anywhere you please as long as you know where you're traveling to visit, to completely locked down. We've got all these manual process now to collect data on who's visiting because we have to perform contact tracing. We have to have questionnaires in place to be able to understand, could this person be introducing risk into our organization by just having them on site? And then you had to be able to control from a patient perspective the number of visitors, either to that specific unit or collectively just to that patient. So now you've got all this paperwork that historically, again, is very manual. You're collecting this data, you're putting it on paper, you're having to retain it for a period of time. In the event you have to do that contract tracing or even show that you're in compliance regarding all that. And though a lot of those, compliance or county, state regulatory things have gone by the wayside, hospitals have adopted those to an extent. They're still only allowing maybe up to 2 visitors per day per patient. They want to restrict visitation to certain wings of the hospital based on whether it's virus based or the significance of the illness that someone has. And so overall now it's really had to shift to, hospitals are overwhelmed with this manual process. They had to overstaff to be able to manage entry at all of these locations. How do we now move into a state where we're not only automating some of these processes and allowing visitors to come in, check in for a patient without ever having to interface with a highly paid guard or someone that has other responsibilities, and then from there be able to show that individual, all right, you're approved to come in, you're maybe even on a white list for that particular patient, right? Putting the power of integrating into HL7 into the hands of the unit and the patient to say, I only want these 2 people to come see me. Anybody else, don't let them come see me. And so you're on that white list. Now you know which unit to go to, you know which room, and you can even get a self-expiring badge printed for you, little sticker badge, throw it on your shirt so that everybody within the hospital from a visual perspective knows that if you don't have a hospital ID badge, when you're traveling through that unit, you've got that sticker, you've been approved, you're authorized to be there, and you're going to see the right person. So it's all those things that we're collectively seeing come to a head now that allows for not only that automation and collection to happen electronically, but now we're also able to see the ability for hospitals to now run reports and make sure that they're within compliance, and that this check-in process is not only improving the experience for visitors, but we also want to see those patient scores go up as a result of them having control over who comes to see them, and that they're, really having that experience that you want them to have from a hospital perspective, which really kind of leads into this piece, Phil. I mean, as we think about technology and people really coming together in a healthcare space, which there's always got to be an ROI tied to it, right? Is it, tied to being able to do certain medical exams? Is it, being able to get more patients through and their quality of experience is high? Now it's lending itself to what about the other processes that we need to generate and receive an ROI around? And a lot of that is leveraging technology to perform tasks or comb through data in a way that cannot be done manually or without a large team of specialized individuals. So Phil, from your perspective, what are some of the things you are specifically looking at to help you modernize these experiences that have really impacted us the last few years?
Great question, Doug. So one of the ways, and our organization is helping us do that too by getting the leadership, if you will, team to be more involved in different ways in the patient experience. For example, let me give you a quick example where I had a great opportunity, call it Connected Air, where I was able to go into the emergency department and actually be kind of like a reader, a host, a person that was just going around to the different patient rooms and asking if they, some things, whether they had a visitor or whether they were by themselves. Can I get you a warm blanket? Is there anything you need? Do you need a drink or just do you need a pillow or something like that? And if they had a visitor, to kind of to talk to the visitor and see if they were comfortable, and you kind of get that relationship built, because you talked earlier in your conversation there about getting our HCAP scores. Well, security is not part of those questions that come out in the surveys to raise our HCAP scores, and so therefore identifying opportunities that it might be a security officer that's making the round doing that, or a security director, that patients and visitors see other folks other than nursing caring for them. And that's a huge asset to any organization. Now, strategy of being part of teaming up with my colleagues, nurses, are crucial. The CNO is really important. One of the drivers in any organization that I've been at is make sure that I'm with the CNO to partner with all my colleagues and all the units, say, hey, security's here to support. And so that, from my perspective, from a security perspective, that's my strategy. How do I partner with certain divisions? And clearly in healthcare, you've got to partner with nursing, because that's where the patient experience really comes from. And the more and more you start involving yourself with nursing, and the issues and concerns that they may have, and really you can just have a mere presence of security and be able to really create a safer environment. So it goes hand in hand. So that's really where I strategize and try to partner as much as I can with the different senior leaders.
Yeah, Phil, great insight. I mean, when you think about being able to ask those questions, they should be included, right? Did you feel safe when you were in our facility? Did you have a good check-in experience, right? All those things should probably be part of that process. Well, Jeanette, you've been on the sidelines here for a little bit. Definitely got a few questions for you. So we're talking a little bit about kind of that convergence of not just security, but also that patient experience. And so what are you kind of seeing that technology stacks and physical security are including now to better help accelerate adoption and really the value when we talk about promoting safety and security in a historically, very cost driven center?
Right. One thing for sure is that there's no one single solution that is going to get the job done. And Phil, I think you could agree with me on that, right? It's multiple, it's technology, it's solutions, it's resources, which I know resources are tough to bring in the right resources that you need, but it's investing in those right solutions is a real game changer. And I know budgets are tight. I know there's restraints and there's reductions of, a heavily a push to reduce operational costs year after year. But if you work with the access control systems, your camera, your CCTV, your video, your visitor management solutions, identity and access management, contractor management, you can see where it's a long list, right? But if you look at those priorities and say, which one of these solutions are going to have the biggest impact on what we're doing today and what we need to achieve? All those points about reducing security incidents, keeping our nursing staff safe, medical security safe, and so forth. But it's that integration among those systems. And at the end of the day, data is king. So you think about the IAML, data, that artificial intelligence. What does that bring to the table? How can you use that data to make us smarter, to make us more intelligent? And that enables us to look at insights and recommendations with that data. So think about, from a visitor management solution, we know the peak hours of visitors. Who are the frequent flyers? Why is this visitor coming in for the last 14 days? Whether they're there to see an inpatient or an outpatient. Have we properly validated and vetted all those visitors coming in on who's hitting an internal watch list or an external watch list? So that data is very, very powerful. One thing I think we need to start thinking also, and it's really to the next level, is that insider threat type solutions. Think about that visibility it brings to security. It's a whole new level, right? Prediction of behavior. We're here to predict what's going to happen. We're trying to figure out, maybe there's people that has too much access, or people that are abusing access, that are coming in odd hours, or maybe coming in areas that they really shouldn't be coming into. It's taking a proactive approach on reducing potential incidents and really helping security have visibility and eyes in a proactive approach versus a reactive approach. And Phil, would you reiterate that the data that we're using from an artificial intelligence perspective can give a hospital a whole new level of insights that maybe they haven't been utilizing before?
Yeah, that's a great thing that you're talking about. The artificial intelligence is so important. If you don't have that, it's when let me say it this way: if you have it, that's great, and you're utilizing it, really benefits the organization and the security department to be able to do their investigatory uh, investigations, to be able to track just what you were reiterating about. Now that we're post pandemic, we've got more and more activity in our organizations, and when you start to have more people coming into your organization, you've got opportunity for more theft, more stranger things than what you've been dealing with for the last 2 years. So utilizing the artificial intelligence and so on and so forth, it's so important. It tracks data for you. And when I strategize by partnering, the information you get from folks on your rounds and taking the time, you're getting the real intelligence from them too, and then putting it into the systems that allow you to start to track and identify, and then really capture what you really need to in your organization. Then you're starting to find again a reduction. We saw a great reduction um, in at least my organization, and I'm sure my colleagues would agree, we saw a reduction in theft. We saw a reduction in lots of other activities because we didn't have folks in. Now that they're in, if we could be using the technology to follow, to just put in a segue of, hey, watch this area, or hey, know that someone's coming into this area every day at 2 o'clock in the morning. Let's make sure that camera is ready and start putting those analytics in the system. So it just helps us to be smarter and to be a little bit more proactive, uh, although it is a reactive to something that may have been triggered or something that's come into your organization caused you some heartache. So it goes both ways, but it then starts your team to also think proactively on how can we create even a safer environment than what.
Yeah, so two things that were really important out of that. The first one is I'm sure a lot of you on this webinar are part of organizations that have gone through a lot of merger and acquisitions. And through that process, you end up having to have responsibility for multiple disparate systems. You've got 3 or 4 different access control systems spread out across multiple different locations. And so you've got the challenge of one, how do you unify those? How do you bring that into a common platform so that
Yeah.
you can easily provision and, more importantly, deprovision access rights for those individuals? If you've got a bad termination that occurs with an employee, you want to know with certainty that in real time when their status is updated in human resources, because they're usually the first to know that that employee's been terminated, their access rights and the access control, no matter where that resides, no matter what type of system it is, those access rights are revoked, again, in real time. The standard time is roughly 72 hours from the time HR is notified to the time security can actually revoke access to a card across most industries. So that's an incredible risk, especially from a workplace violence perspective. The second thing is you've got employees, because of the nature of challenges hiring and having the right talent, who are shared resources across locations. So what if you have an employee now carrying 2, 3, 4 different credentials? How do you get them onto a single credential that can unify those systems that they then themselves can request access rights through an application, or if they lost, forgot, or had their badge stolen, that they can also do those notifications and through simple workflows and automation, notify the right people, have that card that was lost, stolen, or forgotten turned off for a period of time, get that temp badge to that employee in short order so they can get to work. So they have a great experience day over day, and they don't have to be worried about, did I grab my sixth credential? We've healthcare use cases where we have doctors in one particular healthcare organization in Louisiana carrying 10 different credentials between physical and logical access control. Unbelievably bad user experience. So with that, I think it's important to understand kind of from a Convergint perspective, we are constantly evolving, evaluating, and identifying solutions that align with these customer strategies. Technology is starting to reach new heights and being able to solve for many of these challenges and really provide the things that from a human perspective, we just don't have the time or ability to comb through what Jeanette said was this gold mine of data. So Jeanette, as we've expanded our partnership between Convergint and VectorFlow, what would you say is the thing that you're seeing that's most important for hospitals to consider when bringing a solution like this into their facilities?
That's a great question. And as we're working with these organizations, we truly understand that it's just not security. There are so many other stakeholders, or I like to call them beneficiaries of a solution or multiple solutions that are coming in. So, and this isn't just for healthcare. I mean, this is across the board for other verticals as well. But you have your C-level executives, you have nursing, you have security, you have patient services or concierge services, you have legal and compliance folks. So I really like to look at it as you're collectively pulling all these people together and talking through what kind of solutions are going to impact our organization. How are we going to, and everybody asks us from the get-go, how are we going to reduce costs? But also, how are we going to ensure a safe and secure environment? So I like to say when I'm working with hospital organizations, and Phil, you and I have had this conversation, we want this to be a smart investment. We want the organization to understand what the value you're bringing to the table. It's not going to happen it's not a sprint. It is a little bit of a marathon because you grow into these solutions. You understand how your hospital might be a little bit different from another hospital. You might have different policies and different rules that you want to follow. So it definitely is a little bit of a dance, but at the end of the day, you're bringing the right people to the table and you're talking through what are your priorities, what are your requirements, and where do you want to see? What's your vision in moving forward? And this is when I'm going to, Phil, how do you derive change in healthcare? How do you drive this change? Okay, let's say you've got all the people at the table and you're talking through this, but at the end of the day, someone has to say, let's do it. And that seems a little bit difficult because there might be an incident that's driving an emotional incident, like we've got to do something now. They sit back, they wait, oh, it's not going to happen to us. So I'd like to know your strategy on how you're driving change.
Yeah, great. Jeanette, my strategy for driving change is consistency, and just keep going back to the table and being able to put ROI, if I can, with some of these solutions, how it's dealing with. Understanding that some of these instances are impacting our patient care, even though there may be an incident against the patient, but the way we're doing business and how we can control situations, how we can monitor our facilities through our technology. And to be honest with you, I think you hit it on the head. It could be really expensive and it's not going to happen overnight. But if you strategically put a timeline or a plan together where this is multifaceted over a period of time, it doesn't cost. It's going to cost the same, but it's not going to be. You're not going to feel it. The organization's not going to feel it right away. So putting together with the C-suite, making sure you're with them and that they've got buy-in to be able to prove to them that this is the way we need to go because of the patient experience. Right now the C-suite is always into the patient experience. If you can prove to them that this is going, to increase our patient scores and increase the patient experience, make it more positive. I think that's the way to go.
Perfect.
Yeah, which really brings us to what those benefits for hospitals are when they adopt a visitor management platform, right? So, key things, right? How long does it take for these systems to get deployed? You want it to be up and operational in days, not months, right? Depending on your workflows and if you choose to integrate with an HL7 and give patients that ability to dictate who can be a visitor to their room, right? Yeah, that can add a little bit more time and additional security reviews. That's why it's good to have alignment with not just from the security perspective, also your IT sponsor, your executive sponsor from a C-level perspective that understands that this isn't just going to be a security tool. It's going to be an IT tool. It's going to be a patient experience tool and impact real estate facilities, as well as the metrics and reporting that can be derived for compliance. So it's a very holistic platform that you want to make sure that you understand when speaking with your stakeholders that this can impact multiple people and be a real benefit. So Jeanette, can you just expand on these a little bit more and what they can expect when deploying visitor management software into their hospitals or operational spaces?
Absolutely. And, to your point is visitor management is here to stay in healthcare. It's not going away. If you did not have it before the pandemic and now you're looking at trying to find it. So in order for a visitor management to be effective and be powerful within your organization, it's really about managing that patient and that visitor experience. I think you've heard this say it over. It's about having control over who's coming into your facility, knowing who they are. And another key aspect of the benefit is having control over maybe visitors to a specific patient, visitors to a specific unit or area, behavioral health, labor delivery, NICU, emergency. That's a high area of traffic as well as a high risk area. So really maintaining that control, but then there's also limitations. Maybe certain areas like ICU, there's smaller rooms, it's very busy. So you want to reduce the number of visitors that you're allowing to have access to that key areas. I mean, it's all about, I want to say gaining control, but knowing who's in that building, knowing what their purpose is. We have lots of visitors that are coming in for professional reasons, interviews. There might be vendors or pharmaceutical reps. So what's their purpose? Is there a appointment that they have registered with that particular doctor to see? Gaining control of who's coming in and out. And at the end of the day, it's about keeping the nursing staff safe. And they love a visitor management solution because they know if there's a family member coming in, potentially that they've had issues or challenges with before, they can now see, oh, look, this particular person's here. Maybe we should call security. Simple as that. Maybe we should, as a escort, or just to have their presence on that particular floor. So there is lots of different benefits that we can bring to the table with our visitor management solution that goes way beyond just a single point solution. And I think you might have mentioned it, a sticky badge and a Sharpie where you're writing someone's name. That interface into Epic or Cerner for that HL7 data for inpatient and outpatient. Very, very critical.
Yeah, so Phil, I know these points are really important to you, and I think this is a great closing for us here today, is that for colleagues on this call, how do you help them have conversations within their organization? What is driving the recommendation? And from your standpoint, how can you kind of help everybody make it a critical requirement that colleagues here can kind of hear from you how you've navigated that and made it happen?
Yeah, I think that question was going to Phil. Can you hear us?
Yep.
Yeah.
That's okay, Phil.
Yeah, I'm sorry.
Phil, yeah, just if you want to talk about
to our guests here, I apologize. I missed the lead there. I apologize for that. Can you go right back to that, Doug? I apologize.
No worries, Phil. So just really to close us out, help us understand how your colleagues on this call can drive these conversations into their organization.
Thank you. So, driving these conversations are and again, it's who we report up to make sure that we can have, if you don't report up to the C-suite, how do we get introduced to the C-suite? If we are reporting up to the C-suite, how much buy-in do you have with whoever you're reporting into? I think being involved with every aspect that you possibly can, that patient care experience, I think that gives you some leverage. Your partnerships with nursing, I think, really really important. Just being involved, making that you have a voice at the table is so important. Being proactive, and I know that my colleagues on this webinar is we're all proactive. We try to do our best that we can do. It's just continuing to get your voice heard is so important.
Excellent. Well, we wanted to keep this short. We're a little bit past time. So hopefully this gave you a few insights to how visitor management's not only involved, but especially the urgency around the deployment of these systems coming out of the pandemic and now moving towards more of an automated side of things. So I think, it's good to understand how Jeanette and I are working with some of the largest healthcare providers in the US. And everything we kind of talk about day to day is about the depth of the integrations, the workflows, and the experience, right? So myself, Jeanette, host of Convergent colleagues really have the opportunity to help guide you through this, the business outcomes, the user personas, and the experience associated with them to ultimately drive great reporting and compliance metrics. So with that, I do want to share, just if you've got any questions following that, Jeanette and my email address are available. Feel free to reach out. Phil nailed it really early on, right? Why wait for the perfect solution that, when you can really understand and drive action today with emerging solutions. And Vector Flow is one of those that can unify those historically siloed and disparate systems while maintaining that reporting and safe experience around your facility. So